What happened with the forehead is like as time passes, we lost volume in the forehead. Unfortunately, we lost the volume of the fat in the forehead, we lost the volume of the muscle in the forehead, and we lost the volume of the bone. So normally a forehead is like a little concave. It's very bright, it's very clean, has no lines, it has no dents. If you check the forehead of a baby, but as time passes, we lost this beautiness and this youth, and then we begin to have imperfection in our forehead. So aging is one of the reasons why we need to replenish this volume. Not always is about aging that we need to refill the volume in the forehead. Just check sometimes in the mirror and you will see that this dent here is deeper than regularly. You see that it's very empty. That's indicate that you need to revolumize the temple to improve the whole quality of the forehead. When you check in the mirror and you see lines, you don't need to raise your eyebrows to be able to notice these wrinkles. They are already there. They are already caused by probably contraction of the muscle. You lose the volume in the skin and you create a line. So if you check in the mirror, if you see a line there, you might need to revolumize your forehead. The third case is that normally the forehead has to have a curve. It has to be a convexity. So you need to see in the mirror from the side a curve that follows the curve of the scalp, of the forehead, right? Of the bone of the cranius, of the skull. So sometimes the curve of the skull came normal and then suddenly become really flat or really plain. So it's not curved anymore. That create, from the side point of view, a really altered image of the forehead. Why don't we check directly in real cases how is the need of the patient for improving or volumizing the forehead or the temples? So in this picture here, what we notice is that this patient has a dent that is like a line going from the top of the forehead to the eyebrow. And as well, she lost the curve in the external part of the forehead. So in this curve that is lost, it looks like a sharp line down instead of being a curve according to the caliper that we have in the picture before. The treatment here was to correct this part, filling the space and giving back the curve and eliminating the dent in the center. In this case, this patient has lost a lot of volume in the temples. She's a young woman, but losing the volume in the temples make her look not healthy and quite old. When in the second picture, when we replace the volume, we give back the curve, natural curve that make her look younger. In this case, we notice that the patient has what we call non-dynamic or static wrinkles. They are already there and the patient doesn't need to raise the eyebrows to be present. Volumization of the temple will eliminate the wrinkles and contribute to a younger appearance.